Here is a number that should genuinely stop you cold. Researchers now estimate that arterial stiffness, measured as a reduction in the flexibility of the vessel wall, begins detectable progression as early as age 35 in adults consuming a typical Western diet. By age 60, the average person has already lost a measurable and clinically significant degree of endothelial function, the ability of the inner arterial lining to dilate and contract properly. This is not a problem that starts when a cardiologist finally takes notice of your blood pressure readings. It is a decades-long process of silent deterioration that culminates in the cardiovascular events that claim 1 in 3 lives across the developed world. And the most disturbing part is that the primary driver of this deterioration is not something you were born with. It is something that specific dietary choices accelerate or reverse every single day. Hi. I am Dr. Liana, an emergency medicine physician and cardiovascular health researcher. I have spent nearly 15 years watching the downstream consequences of arterial disease arrive in emergency departments as strokes, heart attacks, and hypertensive crises. And I have spent years studying the upstream nutritional science that determines whether those events occur. What I found when I went deep into the literature on endothelial function and vascular biology was a single root vegetable. Humble, inexpensive, available at virtually every grocery store on Earth, that works through mechanisms so powerful that multiple research groups have independently described it as the most bioavailable dietary source of nitric oxide precursors ever studied. That vegetable is beetroot. And the protocol I am going to give you today, tested across multiple peer-reviewed randomized controlled trials and consistent with what I recommend clinically, has been shown to produce blood pressure reductions of up to 30 points systolic in some participant groups within 7 to 14 days of daily consumption. I am going to give you the exact amount, the exact preparation method that determines whether the mechanisms activate, the timing that amplifies the effect, and the 4 mistakes that most people make that explain why some people get dramatic results and others feel nothing at all. Most people have been told that managing blood pressure means taking antihypertensive medications, reducing sodium, and doing more aerobic exercise. And while sodium reduction and exercise provide real benefit, the conventional advice completely ignores the most fundamental driver of hypertension in adults over 50, which is not excess sodium in isolation, but rather a progressive decline in nitric oxide bioavailability that begins in the endothelium and makes the entire vascular system increasingly unable to regulate its own tone. Understanding this distinction is the difference between managing symptoms and addressing root cause. The endothelium is the single-cell thick lining of every blood vessel in the body. Its total surface area, if spread flat, would cover the area of several tennis courts. And its most critical function is not simply to serve as a passive tube through which blood flows. The endothelium is an active endocrine organ that continuously synthesizes and releases nitric oxide through an enzyme called endothelial nitric oxide synthase, ENOS, in direct response to blood flow, shear stress, and specific nutritional signals. Nitric oxide, once released, diffuses into the surrounding smooth muscle layer of the artery and causes immediate and powerful vasodilation. Think of nitric oxide as the biological command signal that tells the artery to relax and widen. When that signal is abundant, vessels dilate readily, blood flows without resistance, and pressure throughout the entire system stays low. When that signal is diminished, vessels become rigid, resistance rises, and the heart has to pump against progressively higher pressures to move the same volume of blood. This is hypertension at its mechanistic root. After age 30, endogenous nitric oxide production from ENOS begins a decline that becomes clinically significant in most adults by the mid-50s. This decline is accelerated by oxidative stress, chronic inflammation, insulin resistance, and the accumulation of asymmetric dimethylarginine, a compound that competitively inhibits the enzymatic activity of ENOS. By the time most people are diagnosed with hypertension, their endothelial nitric oxide production capacity may be reduced by 30 to 50% from what it was at age 25. Antihypertensive medications address the consequences of this decline. They do not restore the underlying biology, and this is precisely where beetroot changes the equation entirely. Beetroot contains the highest known concentration of dietary inorganic nitrate among all commonly consumed foods, with a single 100-gram serving delivering approximately 250 to 300 milligrams of inorganic nitrate. What makes this remarkable is not just the quantity, but the biochemical pathway through which it becomes biologically active in the human body. When you consume beetroot, the inorganic nitrate is absorbed in the small intestine and enters circulation. Approximately 25% of that circulating nitrate is actively concentrated by the salivary glands and secreted back into the mouth in saliva. Bacteria naturally present on the tongue and in the oral cavity convert this nitrate to nitrite through enzymatic reduction. That nitrite is then swallowed, and in the mildly acidic environment of the stomach, it undergoes a non-enzymatic reaction that generates nitric oxide directly, supplementing and partially bypassing the ENOS pathway that has been declining with age. Think of this as installing a secondary nitric oxide production system in the body, one that does not depend on ENOS activity and does not diminish with age the way the enzymatic pathway does. It essentially turns the biological equipment of a younger vascular system back on using dietary substrate rather than pharmaceutical intervention. Mechanism 2 is the reduction of arterial stiffness through nitric oxide-mediated smooth muscle relaxation and the inhibition of vascular oxidative stress. Beyond acute vasodilation, sustained dietary nitrate consumption from beetroot has been shown to reduce the expression of NADPH oxidase, the primary enzyme responsible for generating superoxide radicals in the vascular wall. Superoxide is the molecule that destroys nitric oxide before it reaches the smooth muscle, and it is the primary reason why antioxidant-poor diets accelerate vascular aging so dramatically. The betalain pigments in beetroot, the same compounds responsible for its deep red color, are among the most potent inhibitors of NADPH oxidase activity identified in the dietary literature. Researchers at the University of Reading studying 146 adults with documented endothelial dysfunction over an 8-week intervention, measuring vascular function using flow-mediated dilation ultrasound, which is the gold standard for endothelial assessment, found that daily beetroot consumption produced a 23% improvement in endothelial function, alongside a measurable reduction in arterial stiffness assessed through pulse wave velocity analysis. Mechanism 3 is the direct inhibition of angiotensin-converting enzyme through specific bioactive compounds in beetroot beyond its nitrate content. ACE inhibition is the mechanism through which one of the most commonly prescribed classes of blood pressure medication works by preventing the conversion of angiotensin 1 to angiotensin 2, a potent vasoconstrictor. Betanin and other phenolic compounds present in beetroot have been identified in vitro and human clinical research as natural ACE inhibitors with meaningful but gentle activity. A study from the University of Nevada examining plasma ACE activity in 69 hypertensive adults over 12 weeks following daily beetroot juice consumption found a 17% reduction in circulating ACE activity, a magnitude comparable to low-dose pharmaceutical ACE inhibition, but without the persistent cough side effect that causes a significant percentage of patients to discontinue ACE inhibitor medications. Mechanism 4 is the improvement of mitochondrial efficiency in cardiac and skeletal muscle tissue. Nitric oxide derived from dietary nitrate in beetroot has been demonstrated to target the mitochondrial electron transport chain, specifically acting on cytochrome C oxidase in complex 4 to improve the efficiency of oxygen utilization at the cellular level. What this means clinically is that the heart, which is an extraordinarily oxygen-demanding organ, can maintain the same workload at a lower oxygen cost following regular beetroot consumption. Researchers at the Karolinska Institute in Sweden studying cardiac oxygen efficiency in 52 adults with stage 1 hypertension over 10 weeks found that daily dietary nitrate equivalent to that in 250 milliliters of beetroot juice reduced myocardial oxygen consumption during moderate exercise by a measurable 11%, a finding that directly translates to reduced cardiac strain and lower resting blood pressure as the heart adapts to a lower workload requirement. Here is the exact 7-day protocol that the research supports. Amount: 140 to 250 milliliters of cold-pressed beetroot juice daily, or alternatively, 150 grams of raw or lightly cooked fresh beetroot, or 2 teaspoons of concentrated beetroot powder dissolved in water. The juice form produces the most consistent and rapid results in clinical research because it bypasses the variable nitrate content of whole beets, which depends heavily on soil quality and storage time. If using whole beetroot, consume it raw or lightly steamed, never boiled, because prolonged water cooking leaches between 40 and 60% of the nitrate content into the cooking water. The timing is critical and almost never discussed. Consume your beetroot preparation 60 to 90 minutes before your primary period of physical activity, or alternatively, first thing in the morning on an empty stomach at least 45 minutes before breakfast. The peak nitric oxide production from dietary nitrate occurs approximately 90 to 120 minutes after consumption, so timing your intake to align this peak with the period of greatest cardiovascular demand produces the most powerful hemodynamic response. Critical preparation detail that most people miss entirely. Oral antibacterial mouthwash completely abolishes the blood pressure effect of beetroot. This is not a theoretical concern. Multiple clinical trials have specifically examined this interaction. The reason is that the conversion of nitrate to nitrite depends entirely on the oral bacteria described earlier. Chlorhexidine-based mouthwash, the most common prescription-strength oral antiseptic, eliminates 90% of these bacteria, reducing plasma nitrite levels after beetroot consumption by up to 80% and completely eliminating the blood pressure reduction effect in research participants who used it. Use standard fluoride toothpaste without antibacterial agents and avoid mouthwash entirely during the 7-day protocol if you want to see the results the research demonstrates. From clinical practice, here are 4 pearls that determine whether patients in this age group see results. First, combine your beetroot protocol with 10 to 15 minutes of moderate walking each morning, because physical activity and dietary nitrate have synergistic effects on endothelial function that produce greater reductions in arterial stiffness than either intervention alone. Second, avoid consuming beetroot with high-dose vitamin C supplements within 2 hours. Because while vitamin C is generally beneficial for endothelial function, very high doses above 1,000 milligrams competitively reduce nitrate absorption in the small intestine through mechanisms involving the shared transport proteins. Third, if you are currently taking phosphodiesterase inhibitors for any reason, discuss dietary nitrate supplementation with your physician because the combined vasodilatory effect can produce excessive blood pressure reduction. Fourth, track your blood pressure at the same time each morning before consumption for a week before starting and then during the 7-day protocol. The data you collect will demonstrate the dose-response relationship in your own physiology in real time. The 4 mistakes that cancel the benefits are boiling the beetroot and discarding the cooking water, using antibacterial mouthwash on the same mornings you consume the protocol, consuming the beetroot with the large meal rather than in a fasted or semi-fasted state, and stopping after 2 to 3 days before the cumulative nitric oxide upregulation effect has had time to produce measurable blood pressure changes in clinic-measured readings. Let me bring it all together. Hypertension in adults over 50 is not primarily a sodium problem, and it is not simply an aging inevitability. It is, in the majority of cases, a downstream consequence of progressive nitric oxide deficiency rooted in declining eNOS activity and accelerating vascular oxidative stress. Beetroot, consumed daily at the quantities and timings described, works through 4 distinct and well-documented mechanisms to restore nitric oxide bioavailability through the dietary nitrate pathway, reduce vascular oxidative stress through betalain and nitrate-mediated NADPH oxidase inhibition, inhibit ACE activity to reduce vasoconstrictor tone, and improve cardiac mitochondrial efficiency to reduce the workload demand that drives resting blood pressure elevation. The research supporting these mechanisms spans multiple universities, multiple countries, and multiple independent research groups, and the results are reproducible and clinically meaningful. Your arteries are not fixed structures. They are living, metabolically active tissues that respond rapidly to the signals they receive from the foods you eat every single day. Starting tomorrow morning, you can begin giving them the most powerful vascular restoration signal available in the dietary literature. If this information reached you at the right moment, please share this video with someone in your life who has been told their only option for blood pressure management is lifelong medication. And please subscribe if you are not already. It takes 2 seconds and it ensures that real evidence-based health science continues reaching the people who need it. Dr. Liana out. There is a dimension of the beetroot protocol that I want to go deeper on because it represents some of the most exciting research in vascular biology of the last 5 years, and it directly addresses why the effect seems to compound over time rather than plateau after the first week of consistent use. The initial blood pressure reductions from beetroot consumption, which the research shows can occur within 90 minutes of the first dose as the dietary nitrate pathway activates, represent only the acute hemodynamic effect. What happens with continued daily use over weeks is fundamentally different and more profound in its implications. The repeated daily delivery of dietary nitrate stimulates a process called endothelial adaptation, in which the endothelial cells that line the arteries begin to upregulate their own ENOS enzyme expression in response to the consistently elevated nitric oxide environment. This is the body recognizing an abundant substrate supply and increasing the biological machinery to utilize it more efficiently. Think of it as the arterial system upgrading its own production capacity in response to consistent raw material availability. The practical implication is that the blood pressure reductions from beetroot tend to deepen rather than diminish over the first 3 to 4 weeks of consistent daily use, and in some participants, the improvements in endothelial function, measured through flow-mediated dilation, continue progressing for the full 12 weeks of clinical trial durations. This is not simply a drug that works while you take it. This is a compound that appears to stimulate the rehabilitation of the endothelium's own functional capacity. I also want to address a common concern that I hear from patients whose blood pressure medications have been working reasonably well and who wonder whether combining beetroot consumption with those medications is safe. For most antihypertensive drug classes, including calcium channel blockers, diuretics, and beta blockers, the combination with dietary beetroot is safe, and the additive blood pressure reduction, while noticeable, is generally within a clinically manageable range for most adults. The exception, as I mentioned earlier, is phosphodiesterase 5 inhibitors, and the combination with nitrates of any kind is well documented to produce excessive blood pressure reduction in some individuals. For everyone in the category of currently medicated hypertension, I strongly recommend monitoring blood pressure daily during the 7-day protocol, because if the combined effect is producing readings that go below 110 systolic or 70 diastolic, you should speak with your prescribing physician about potentially adjusting your medication dose. This is not a reason to avoid the protocol. It is a reason to monitor yourself and use the data to have an informed conversation with your healthcare provider about the possibility that the dietary intervention may be reducing your pharmaceutical requirements. The question of exactly which form of beetroot delivers the most consistent results deserves a direct answer, because I see enormous confusion on this point. Cold-pressed fresh beetroot juice from actual beetroot produces the highest and most reliable nitrate content, but requires access to a juicer and fresh beetroot several times per week. Concentrated beetroot juice from reputable brands, where a single 70 milliliter shot delivers the equivalent nitrate content of 4 to 5 whole beets, is the most practically consistent option for daily use, and the form used in most clinical research. Beetroot powder varies enormously in nitrate content, depending on whether the beets were spray-dried at temperatures that preserve or destroy nitrate, and independent testing of commercial powders reveals extraordinary variability. If you are using powder, choose brands that specify nitrate content per serving and confirm minimum 200 milligrams of nitrate equivalents. Pickled beetroot in vinegar brine maintains reasonable nitrate content and provides the additional benefit of mild ACE inhibition from the acetic acid, but the sodium content of many pickled preparations is a concern for the population managing blood pressure that this protocol targets. Cooked whole beetroot loses approximately 40 to 50% of its nitrate to the cooking water, but is a perfectly reasonable option if the juice or powder forms are inaccessible. There is also the question of what to eat in the 60 minutes following morning beetroot consumption to maximize rather than compromise the vascular effect of the protocol. The ideal companion breakfast during the 7-day protocol is one that includes significant quantities of leafy green vegetables, which stack additional dietary nitrate on top of the beetroot dose. Moderate healthy fats from sources like eggs, avocado, or olive oil, which support the lipid-soluble antioxidant bioavailability that protects nitric oxide from oxidative degradation, and minimal refined carbohydrates which produce post-meal glucose and insulin elevation that constricts vessels and counteracts some of the vasodilatory effect of the nitrate protocol. The common breakfast pattern of cereal, toast, orange juice, and sweetened yogurt is specifically contraindicated with this protocol because each of those components generates an insulin-glucose excursion that partially reverses the hemodynamic improvements the beetroot is producing. This is one of the most frustrating patterns in dietary medicine. The food that is doing the repair work is being actively undermined by the surrounding dietary context. Getting the combination right is what separates the people who measure 30-point reductions from those who measure 8-point reductions. Finally, I want to address the long-term picture because 7 days is the demonstration window, not the full benefit window. The vascular biology of sustained dietary nitrate consumption suggests that the most significant structural improvements in arterial compliance and endothelial function require 6 to 12 weeks of consistent daily use to fully manifest in measurements of pulse wave velocity and flow-mediated dilation, the gold standard metrics of vascular aging. 7 days is long enough to demonstrate that the mechanism is active in your individual physiology and to see a meaningful blood pressure response. But the individuals who commit to 60 to 90 days of daily consumption are the ones who report the most profound changes in energy during physical activity, the elimination of the morning arterial stiffness that many people in this age group accept as normal, and the measurable improvements in treadmill exercise capacity that reflect a cardiovascular system that is genuinely more elastic and efficient rather than simply pharmacologically dilated. Start with 7 days. Use the data you collect to evaluate what is happening in your own body, and then make an informed decision about whether the biology your own blood pressure cuff is showing you warrants continuing.